Well, today on the show, we're back out of the Southern Institute of Facial Plastic Surgery. Going to talk to Dr. Arya Namin and find out some of the other great things that they do provide for their clients, you know, like Botox, Juvederm, and some other great things you might want to do a little touch-up for yourself. Dr. Arya Namin with the Southern Institute of Facial Plastic Surgery. Good to see you again, sir.
Yep, nice meeting you again.
Give us a little bit of background about yourself, if you would.
Well, I'm a facial plastic surgeon that joined the practices of Dr. Pashota and Dr. Bratton here on the Gulf Coast of Mississippi. And I'm a facial plastic surgeon is somebody who's an ENT doctor or a otolaryngologist, head and neck surgeon who then went on to do an additional year of training in facial plastic surgery. And that's cosmetic and reconstructive surgery of the face and neck. And we do both surgery and non-invasive treatments.
Now, you've got 3 locations here on the coast, over in Gulfport, and as well as here in Biloxi and in Ocean Springs as well, serving the Gulf Coast.
Yep.
So, why'd you decide to come to the coast? You're from out of state, way out of state.
Yep. I really like the area, and I really like Dr. Pashota and Dr. Bratton, the practice they had here. And there's never really been a fellowship-trained facial plastic surgeon here on the coast, and so I thought it was a great opportunity to come join the community.
Now today we're going to be talking about non-invasive things that you do. Explain some of those.
So with cosmetic treatments, it's all about what the patient is bothered by, right? Some people ask, oh, do I need this, do I need that? And it's really a matter of, is it affecting your confidence, right? And then I need to figure that out from the patient. And then I got to figure out what tools I have to help them with that thing that's bothering them. And so sometimes surgery is the best option, but other times for more minor wrinkles or some depressions in the face or the desire to have bigger lips, we can do Botox or injection type treatments.
The Juvederm and all that.
Correct.
Instead of having to, as you said, the more invasive facelift kind of things.
Correct.
And we've already talked about what we could do for this. So that might be on a future show.
That's right.
Talk about. Well, let's go back. I believe you have a model back there, including myself, to show some of your procedures on.
Let's do it.
Now, Amanda is in for a touch-up, as you said. She's one of your regular patients.
Yeah, she's a great patient of mine, and she's one of our teammates here at the office, otherwise known as my spirit animal. And I've done her lips before, and she used to have a very small upper lip, and it's bothered her for quite some time. And we did about almost 1 cc a few months ago, and her upper lip still looks really nice, but she wants a little bit bigger, more plush, and so we're going to give that to her today. You excited about this?
For sure.
And then we're also going to do a little bit of Botox. She doesn't have much in the way of wrinkles, so we're going to do a very small amount of Botox to her crow's feet, kind of this area of the eyes. And we'll do that first, okay?
Okay. Now, go ahead. I'm just, while you're getting that all set up, I'll just ask you some questions. What exactly is Botox, and I know a lot of people know that, but just...
Yeah, so Botox is otherwise known as a toxin, and it basically paralyzes muscles. And so in large doses, it can be quite toxic, but in small doses, it relaxes muscles of the face, and the muscles of the face are what creates wrinkles.
Right.
And so by relaxing those muscles, it improves the wrinkles of the face.
Now, I've had people say that they've gotten Botox to help with headaches.
1, 2, 3. One, two, three. Yeah, Botox can help with headaches and migraines. And so that is an option for certain patients.
One other thing, I'm going to move out of your way because I know you got to get over here to the other side. Years ago, my father had a issue with his throat where it would close up on him, and they would expand it out with open it back up because his esophagus would close up, and they started going in and injecting Botox in it.
Yep.
And relax the muscles.
Exact same concept. That's right. And I do that occasionally for patients as well for swallowing issues.
All right. Well, we're going to let him finish it a little bit here, and then he's going to watch him do some Juvederm. Now you're doing the Juvederm.
Correct. Now we're doing the Juvederm, and Juvederm is a hyaluronic acid filler, so it's a, it's a compound that's naturally found in your skin, and it helps volumize tissues. And so in the lips, it can give nice volume to the lips. But this is a little bit more uncomfortable, so our lips have already been numbed with a very powerful topical numbing medicine to help with the comfort of this.
Okay, and then you just put this in different areas, and
Yep.
and it helps kind of plump them up.
Yep.
Gets rid of what I call the Reba McEntire lips, because
That's right.
Reba has no upper lip. Well, she's got a great voice. And how long do these, I mean, the Botox and the Juvederm, how long does it usually last?
So Botox, typically you need to get done about 3 times a year. It lasts about 3 months. And then Juvederm and the lips move a lot. And so it only lasts about 6 months before you need an additional treatment. Mm-hmm. And so other parts of the face, it lasts a bit longer, sometimes a year or longer. But the lips, because they're constantly moving, only lasts about 6 months. And so you need to come in about twice a year for touch-ups to help keep that augmentation.
Now, could Juvederm be used in anything besides lips?
Absolutely, in the cheeks. Now we use different formulations of the filler in different areas because of the cross-linking, the way the hyaluronic acid is formed. And we want a different formulation for different areas. But in the mid-face, in the lower eyes, in the jawline, it can all be very helpful.
So I guess that one's for me, huh?
Yes, sir.
Okay, so guys, there's no reason why you can't get Botox too.
That's right. I do a fair amount of cosmetic treatments for men, treatments for the neck, sagging eyelids, sagging eyebrows, and so definitely can help men a lot with that treatment. And Jim here is a very handsome man, but he has some fairly thick wrinkles, deep wrinkles up here in the forehead and in the glabella, so we're going to treat those today. So why don't you lean your head back.
Okay.
All righty, and here we go, bud. Just relax for me first.
Okay, I'll relax.
Just relax. Good.
Well, that's not too bad. So if you want to find out what kind of treatments you might need, what you need to do is give them a call. They are located at 3 locations here on the coast. Well, he's going to finish me up here in just a minute. But you can come over here to Tommy Monroe Drive in Biloxi, also in Gulfport or in Ocean Springs. Guys, you can do this too. There's no vanity, nothing wrong with it. But get it done and get yourself looking good.